And we also have a decreased thirst sensation, which really you can see now it starts creating a real concern for the culinary professional, especially if you're dealing with long-term care facilities or, senior homes. You may think that a certain menu is appropriate, but then when you look at the dental issues that some of them are being affected by, ability to chew, maybe they have poor dentures that don't fit well, maybe their teeth are falling out because they're not strong anymore. You can see the number of things that are going to affect your menu development. And then, of course, even just the digestive process slows down. So you have to think about that, and also foods that might help prevent constipation and heartburn in this population. In the aging process, the metabolic rate slows down about 10% or 5 to 10% every decade. So as we age, we tend to replace some of our muscle with fat, and it affects what we're eating, and it affects our appetite and everything. So we have to think about these things when dealing with the aging population. Organ systems decline. We've already talked about the heart and how it's affected by diet, blood pressure, kidney disease is a whole other ballgame. Loss of bones, osteoporosis is a concern. So, it's extremely important to think about, what you're serving and keeping it appealing. Let's say you have an older person that has swallowing issues. No one wants to look at a plate full of mashed up baby food. So if there's a way to make it a little bit more exciting. And then just like every age group, older adults still need regular activity. So when we're looking at the nutritional needs, number one, because the metabolism is slower, because maybe the muscle tone is less, there's less need for calories. So what you would normally eat when you're 20 or 30, it's so much less than when you're eating at 70 or 80. So when you have fewer calories, when you have a fewer calorie budget to work with, that means there's even less room for some of those empty calorie foods like pies, cakes, cookies, jams, jellies. So you have to think about that as well as all the different nutrient concerns. Because people may experience a decrease in thirst sensation, you have to make sure that you incorporate water because they forget to drink. And many times dehydration could be the one thing that causes them to lose their independence, because if they don't drink enough, or maybe they're losing fluid in the form of diarrhea, it can cause them to lose their independence and also have long-term health issues because of electrolyte imbalances. So a lot of things to consider for older adults. And then, of course, calcium continues to, be necessary. B12, adults sometimes lose the intrinsic factor or the ability to use B12, even if they're eating foods that are high in B12, like your animal products. Adults over 50 don't necessarily absorb it as well. So that's why nutrient density and fortified foods is so important. Another concern, another nutrient that's of concern is vitamin D. Because of the use of sunscreen, and maybe for institutionalized seniors, they're not getting out in the sun, so they don't have that ability for their body to make vitamin D from the sun. They may have an issue with vitamin D. So these are all real concerns that have to be addressed. When you're dealing with the older population, similar to a child, you want to offer moderate-sized meals. A whole sandwich is going to overwhelm, a senior. So maybe half portions, small plates. Again, emphasize high fiber foods for those that are combating constipation or even diarrhea. We would use high fiber foods to create more of a bulky stool. Moderate fat use. Dairy continues to be, one of the food groups we promote because it's one of the best sources of calcium and vitamin D that continuously needs to be included. And then, of course, adequate protein. And because of the incidence of blood pressure issues, moderate use of salt and also processed foods. And that can be a real problem because many seniors, live on that instead of eating whole food. So it's a concern on a daily basis. But for the purposes of making it more attractive and appealing, herbs and spices are very good, including a variety of food, including international food. It's important to always think about the culture of the person you're dealing with. So, we've talked about a lot of these things. A lot of this is a review. So, what about something like an eating disorder? If you're ever in an institution where you're dealing with food preparation for, eating disorders, it's important to just have somewhat of an understanding about it. An eating disorder is an illness that causes serious disturbances in everyday diet, such as either eating extremely small amounts of food or maybe even severely overeating. A person with an eating disorder may have started out just eating smaller or maybe larger amounts of food, but at some point, the urge to either eat less or more somehow spiraled out of control. Severe distress or concern about body weight or shape sometimes is also characterized as an eating disorder. It's really more of a psychological disorder that causes, a lot of issues for a person. And that's why, as a health professional, I'm not a big fan of dieting because sometimes dieting leads to disordered eating. People tend to be very stringent with their diets to achieve some sort of ideal, perfectionistic look to themselves and can really, become a problem for them. It's common to feel pressure to be thin when a person has an eating disorder. And there's different types of disorders. There's anorexia nervosa, there's bulimia nervosa, there's binge eating disorder, and then there's, other disorders that aren't, really specified. So let's break those apart a little bit. Anorexia is generally characterized by extreme thinness, and it's a relentless pursuit of thinness and unwillingness to maintain a normal or healthy weight. So the perception of a person's weight gets out of control, and even if they look undernourished or normal to the average person, to them they don't. They have intense fear of gaining weight, distorted body image, and a self-esteem that's heavily influenced by perception of body weight and shape, or a denial of the seriousness of low body weight. Girls and women who extremely restrict their eating sometimes have a lack of menstruation. Many people with anorexia nervosa see themselves as overweight even when they're clearly underweight. Eating food and weight control become their obsession. People with an anorexia nervosa typically weigh themselves repeatedly, portion control very carefully, eat small quantities of only certain foods, or they may engage in binge eating followed by extreme dieting, excessive exercise, self-induced vomiting, misuse of laxatives, diuretics, and enemas. So it's clearly something has gotten out of hand. When you severely restrict your intake over time, you can develop things like thinning bones. So you might have very early onset osteopenia or osteoporosis because you've robbed your bones of, calcium and vitamin D. A person may present with very brittle hair or nails. They have, some of them have a drop in internal body temperature, causing them to never be able to regulate, to feel cold all the time. And then some have this sluggishness or feeling tired all the time. Sometimes there can be anemia. Some of the worst things are damage to the heart, brain, and other organs. So anorexia presents with a lot of different concerns, and it takes a team approach to really help that person. Another kind of eating disorder is bulimia nervosa, and that's characterized by recurrent and frequent episodes of eating large amounts of food and then feeling lack of control over these episodes. And then the binge eating is sometimes followed by compensating behaviors, such as forced vomiting, excessive use of laxatives and diuretics, fasting, excessive exercise, or a combination of all these behaviors. So, unlike anorexia nervosa, people with bulimia nervosa usually maintain what's considered a healthy weight or normal weight. Some are even slightly overweight. But other symptoms they might have would be like a sore throat or swollen salivary glands in the neck and the jaw, worn tooth enamel from all the vomit, and increasing sensitive and decaying teeth as a result of exposure to some of that stomach acid. They could have damage to their GI tract and sometimes severe dehydration. So it's a different spectrum of eating disorder. The third one would be like a binge eating disorder, and that's typically when a person loses control over what they're eating. Unlike the bulimia nervosa, periods of binge eating are not followed by purging, excessive exercise, or fasting. Those that have binge eating disorder are usually obese or at higher risk for developing cardiovascular disease and also high blood pressure. They also have extreme guilt and shame and distress about their binge eating, which can then lead to more binge eating. So, what do we do? How do we handle this? Adequate nutrition, reducing excessive exercise, and trying to stop the purging behavior are really the foundations of treatment for those eating disorders. And there's different forms of psychotherapy or even talk therapy and even medications that can be effective for people with an eating disorder. Treatment plans can be tailored to individual needs, and they can be individual, group, or family psychotherapy. It can be, medical care and monitoring, nutrition counseling. All those play a big part in the treatment and recovery of eating disorders. And many people, suffer a lifetime of those. So, what about our athlete? And how does that change? Every 4 years or every 2 years when the Summer or Winter Olympics roll around, it's always very obvious how different it might be for, an elite athlete. When somebody's burning as many calories as they do with activity, they're going to require more calories and also the substrates, protein, carb, and fat. But as we've said all along, as in the case of a healthy individual, carbohydrates and fats are going to be those primary fuel sources, especially carbohydrates. So when we're looking at a diet and what's appropriate for an athlete, when I say diet, I mean what do they eat? It's generally high in carbohydrates. And whereas we would say 45 to 65% of a normal person's diet should be from carbs, an athlete can eat as much as 60 to 70%. And it may be a little bit higher than normal amount of protein and just your normal fat intake. So, what's the big deal when people say, well, they're an athlete, they need more protein? Well, they're going to get more protein by the sheer fact that their calorie budget is greater. So if you're normally eating 1,800 calories, but because of the number of calories you're burning with training and performance and everyday living, you might require 3,000 or 3,500 calories. So just by the sheer fact that your budget is greater, you're going to get a lot more carbs, you're going to get a lot more protein, you're going to get a lot more fat. So rarely do athletes ever really need extra of any, specific nutrient. Now, when it comes to protein, if they're an endurance athlete or a power athlete, like a power lifter, they are tearing muscle and they are regenerating muscle and building muscle. So maybe they are requiring a little bit more protein. So where the average person only needs zero point 0.8 grams of protein per kilogram of body weight, the power athlete might need 1.2 to 1.7 grams per kilogram. But again, because their overall calorie intake is greater because they're burning more calories and plus they have more body mass, they're going to get more protein as a result of that. And again, like any other, person throughout the lifestyle or throughout the life cycle, for any person throughout the life cycle, appropriate nutrients have to be paid attention to. And for an athlete, it would be vitamin C, E, antioxidants, vitamin E. But but again, because the calorie budget is so great, and if you're focusing on good food, good wholesome quality food, they're going to get these extra nutrients just because they're getting extra quantities of those food groups. I hope that's um, I hope that's clear because again, everyone needs good quality food. Everyone has a different calorie budget. The more calories you get in a day, if you're still eating those good wholesome quality foods, you're obviously getting those nutrients and more of them. Water is very crucial. In fact, an athlete, like anyone else, should never wait until they're thirsty. They need to continue to be hydrated before exercise, during exercise, and after. And generally, they say that before they need to drink between 4 and 8 ounces, and then every 15 minutes during activity. So think about when you're watching a football game and the players are coming off the field and rotating in and out. You'll see them swig, on liquids. And many times, if they're an elite athlete, they're going to be drinking sport drinks with electrolytes and not just water. But if you're an everyday athlete and you're walking in the kind of Texas heat we have, it's important to carry water with you and really make sure that you stay well hydrated and not use your thirst as an indicator for what you really need. So your loss will depend on your fitness level, how long you're exercising, what your body temperature is. I had a client once who was actually in a situation where they were exercising a lot more than they normally would for an extended period of time, and they became so dehydrated they lost their ability to um, regulate body temperature. So it's really crucial to never let it get out of hand, to constantly be up on drinking your water. And then of course athletes sometimes are asked what their dry weight is, and they're weighed before and after an event. And it's best to replace 2 cups of fluid for every pound lost. So if you weighed, 200 pounds before an exercise and you were down or 190 after exercise, you need to drink 2 cups of water for every pound you lost. So it's important to have a handle on that when you're an athlete. So what about sport drinks? They contain a diluted mixture of carbohydrates and electrolytes, and that's really the big difference between a sport drink, a soft drink with sugar, and drinking water. It has a good ratio of carbohydrates and also sodium and potassium that you generally lose when you're in a sporting event. And even if you're just an everyday exerciser at the gym, if you're exercising greater than 90 minutes, you might require a sport drink. But just, an hour of exercise, water does the trick. So, sport drinks are really designed to be used during exercise and not just grabbing a drink when you're thirsty. Athletes sometimes do what they call carbohydrate loading or glycogen loading, and that's a regimen that involves 3 or more days of decreasing the amount of exercise you do and increasing your consumption of carbs, good quality carbohydrates, wholesome carbs. And what that is just loading up your muscles and the carbohydrate is stored as glycogen, so that when you're exercising and you use what your body has, it can use the stores, the glycogen stores that are in your muscles. This is typically done, before an event to increase those glycogen stores, because that's going to help you enhance your performance by providing more energy when you're in a competitive situation over a long period of time. So it really helps to give you the fuel you need rather than just what you've just eaten. You've stored it for future lengthy competition. So some of the guidelines for menu planning for an adult would be to always offer a variety of food, always focus on good carbs. Don't overdo the protein. You still want good balance, just like the My Plate. Your serving size may be 8 ounces instead of 3 or 4, but at the same time, it's a good balance of all the different food groups. Important to focus on fluid and good sources of all of your antioxidants and phytochemicals. And then, consider what competition does and what you need to eat before, maybe even during, and then after, to replace all those nutrients that are lost. Pre-competition meal should be something that is easily digestible and moderate in protein. Generally, they talk about how, football players should have a big steak dinner. That really might be considered too much fat and too rich. So, like an easily digestible carb, like a pasta meal with meat in it, would be a better choice. But, a substantial number of meals are served 3 to 4 hours before competition, because you need to give your body a certain amount of time for your stomach to empty, because otherwise you might experience some cramping. So it's important to space meals out and make sure that you're not eating a big meal closer to the time you're going to compete. So whether you are 5 or 65 or somewhere in between, it's important to tailor nutritional needs accordingly. The basic healthy diet or eating plan can be tweaked in a number of ways for diabetes or other chronic diseases, but all in all, it does represent a healthy way of eating and a very different diet from what most Americans of various ages are eating. So that concludes our discussion on nutrition for the ages. Learning the special needs of patrons is one step, but learning to meet those needs is what sets the successful culinary professional apart from others. As a culinary professional, you have an opportunity to show that planning, preparing, and serving nourishing and appealing foods to guests is not only the right thing to do, but also makes good business sense. Adventuresome diners, innovative technology, and an abundance of healthful ingredients make this such an exciting time to be a culinary professional. So I hope that the basic knowledge that we've discussed over the semester, mixed with creativity, will position you to meet the needs of a challenging marketplace. Hopefully, this class will be your roadmap for your journey, and I sincerely hope you've enjoyed the journey. Thank you.